Hello everyone, I am Dr. Aruna Kumari, consultant obstetrician and gynecologist practicing at Cloud9 Sarjapur and Bellandur units of Bangalore. Electronic fetal monitoring. The machines have helped us in managing the high risk pregnancies very easily because the graph whatever we take for like an adult ECG, we do the graph for the baby. It is called non-stress test. It will show the variations, how is the heartbeat of the baby, beat to beat variability is there. As soon as the baby moves, the accelerations, the heartbeat will increase by 10 to 15 beats and then come back to the baseline, or any dip in the heartbeat is there. All these things can be identified in that one NST test, which is similar to an adult ECG, like roughly to tell in a simple language. Why this test is done? Because it gives the internally factors which are contributing in is the baby under any stress. If NST is fine 48 to 72 hours, the baby is fine and will be fine. That is a reassurance what we get. Need not always we can do ultrasounds. Sometimes patient tells that I had less fetal movements, they come to the hospital. So the immediate basic test what we do is the non-stress test, that is the electronic fetal monitoring. Who are the candidates who have to be doing NST bi-weekly or weekly? This is because if the woman is uncontrolled hypertension or diabetes is there, sugars are very high, means suddenly sometimes sudden heartbeat can go off, stillbirth risk will be there. So for these kind of women, bi-weekly or once in every 5 days we do suggest for the non-stress test. And there are babies with growth restriction or the fluid is less around the baby, or the special conceptions like IVF conception where along with that associated medical problems are there, renal disease or Apla syndrome. These kind of problems when they are there, we have to monitor these babies more vigilantly than the other non-complicated pregnancies. So why electronic fetal monitoring is very useful is, apart from managing during the pregnancies, during the delivery also it helps in the fetal continuous monitoring. Sometimes what happens, the patient tells at 28 weeks the movements are less. Immediately we need not deliver. The NST is fine, we give the woman to monitor the baby movements. Next day we do the Doppler study of the ultrasound and fluid, everything is fine, means we can reassure the woman, ask her to eat frequently and observe for the fetal movements. The NST will tell us at 24/7 any time doing that baby is immediate needs attention or any problem. So many times in the late part of pregnancy, in the term pregnancy, patient comes, just doctor, I am having backache, but movements are all good, no problem for me. She might be previous cesarean. So when we see the NST will be very flat, that variability is not there. Then when we see there will be scar tenderness, so many times we take up immediately for surgery, we can see the scar is very thin or the baby has already passed meconium inside. So these kind of problems can be identified with a simple test of electronic fetal monitoring. And electronic fetal monitoring can be done at home also. So we do have the facility of doing non-stress test at home, which can be the graph interpreted by your consultant, so that you need not travel frequently to the hospital. There are patients with high-risk pregnancies, growth restriction. So many times in Bangalore, traffic coming and going will be very cumbersome for the pregnant woman. So electronic fetal monitoring of NST can be done at home. Some people, because they want to hear baby's heartbeat, so they buy the fetal Doppler machines. So that way they will be monitoring, and if they feel the heart rate is low, they come themselves to the hospital. So this way it is an advantage. But sometimes too much testing also need not be done. So always consult the doctor when the monitoring has to be done. It is a fancy for some people that they want to hear heartbeat and they buy, but they don't check the fetal heart rate. Mother pulse also can be recorded, then they think it is low. So always consult the doctor. Doctor will suggest whether you can go ahead for that test. If any doubts, come and recheck in the hospital doing the test, and that way electronic fetal monitoring has to be judiciously used. In high-risk pregnancies, definitely it is going to help to the clinicians and for the better management and outcome of the pregnancies.